Hi there everyone, it's Sarah here, and I'm just doing a video, like a general video, because it is Scoliosis Awareness Month, and so there's lots of lots of different awareness months for different sort of health conditions, like especially the common ones that lots of people get. And scoliosis is actually probably one of the most common conditions, like a sideways bend or rotation in the spine, because it's just lots of people get lots of injuries, and their body can get more out of balance. And so scoliosis, actually, when you look at the statistics, at some point in all our lives, it's more likely you will get a scoliosis than you won't. Like when you're most people get it when they're older and over 60 years old. But it's like over 60% of people have some sort of a bend or rotation in their spine. So it's very common, but it's not quite as common to get it when you're a teenager, when you're younger, or a child. So I'm doing this video because I got a scoliosis when I was a teenager. So it's more like 2 to 3% of people getting it at this age. And I think it is more common to get it as a teenager than as a child. It's like quite rare that people are born with it. So it's not really like, because it sort of develops, usually, people can be born with it, but basically they don't know, there's not like one cause or an exact cause for scoliosis, because it's like an imbalance in the body, and it's with the spine. Everything grows from our spine in the womb, so we develop from our neurological system, and our bones develop from the top down. So because everything is growing from the spine, like all our bones, all our muscles, and then our organs are coming out, we it's pretty common that if you have like injuries or any sort of illness or like infection or damage to any part of the body, that can pull the whole system out of balance permanently. And so that's why a lot of people get it when they're older, because they have like just an accumulation of loads of different damage to different parts of the body that slowly pull them more and more out of balance. And this and then add on aging and wear and tear, like lack of the body's ability to regenerate and rejuvenate, and and arthritis and things like that, and you get a more degenerative sort of pull. So I think the cause is usually a little bit easier to map and follow if someone gets it later on in life, and because it's so common, but you've got, the main thing with scoliosis is because it's coming from the spine where everything develops, you just got to know that there are so many different causes of what is going to pull that body out of balance, and so there's not, the main thing to be aware about with scoliosis is that there's not one treatment, because there's so many different causes for the condition. So there is this sort of when people get a scoliosis when they're younger and they have like a really quite severe one, that it's almost like, oh, it's like that person's like deformed even, I hate this word, but my scoliosis when I was a teenager, no one else actually noticed it. So it was quite bad, but it wasn't bad enough that people really were like, oh, look at, she looks like a hunchback or deformed, or it wasn't like standout bad, but it was bad enough that our medical system and doctors decided that it needed surgically correcting, because there's like a limit of they measured the angle of how big the curve is, and if it gets over a certain angle, they're worried that it's only going to progress from there, like it could just get worse and worse over the years, maybe because of once your body's sort of out of balance a certain amount, then you're lacking muscle control and gravity takes over, and and then when it does get really big, sort of like, I would say double as big as the limit for surgery, they're like, oh, then it can start squashing your organs, like affect the function of your lungs, and even the heart in some really severe cases. So but yeah, I mean, the cause of it is, like, they call it adolescent idiopathic scoliosis when someone's a teenager, because it can seem more mysterious, like why it's developed as a teenager. So I mean, I think if someone's born with a scoliosis, it seems quite logical that, oh, like this, this is either genetic or it's been caused by the birth trauma or something that's happened, directly in the womb. And it's kind of like, oh, okay, like this is the way they are. They're born like that, out of balance. And yeah, it seems like easier to sort of explain. And sometimes people like who are born with it, I think they can often have an actual misshapen bones up the spine. So, some causes of it are obvious, because if you see someone that literally has misshapen bones that are different shape, and they're, or if someone has like a spinal, like, car accident or injury, and things get crushed and bent, so sometimes it can be obvious what the cause is. Like medical scans actually show up what is damaged and is causing that structure to go out. But yeah, the problem with most adolescent idiopathic scoliosis is that there's no cause that shows up on any of the medical scanning. So it's sort of deemed one of those mysterious, health conditions, of which there are many out there. Like, there are literally so many people that are, have some sort of chronic health problem, some sort of chronic pain, chronic fatigue, and nothing shows on any, like, standard medical scans, and it doesn't show in their blood tests either. So basically, because medical scanning and testing is only, like, sensitive to a certain level, it can only detect if something has got really bad, like it's really obviously damaged, this structure, this organ, there's a big lump there, there's like a, or there's scar tissue that's, like, got so thick in the body that it's, like, clearly pulling, the whole structure out. So yeah, like, I mean, yeah, you can see the cause in these type of things. And also scoliosis can come after brain injury or spinal cord injury. So then again, we know that person's had, like, a stroke or a spinal cord, we know exactly how the damage has been caused. And yeah, the body gets out of balance for obvious reasons. If you're having damage to the neurological system where the spine is, and the muscles lose their strength and they become weak, and yeah, it would pull the whole spine out. But yeah, it is quite mysterious if you had nothing shows on any scans, and you haven't had any, you have a scan of the spinal cord and the brain, there's nothing showing, and you're, like, seem like a normal healthy teenager, you're doing well at school, and the only real symptom that anyone gets, is some aching and a little bit of pain in their back, and I didn't even really get any pain in my back either, because I was so young and active and flexible, like supple. I just compensated for it, and I didn't really. So it was quite mysterious, and it can be in a lot of cases, and it's more common in females when they're going through. So it happens when people are going through puberty, and they're having hormonal changes, and big growth spurts. So I think the main cause here is that someone can have an imbalance in their body. They can be, like, more subtle, and it can be there from birth. So it can be there from birth trauma or something like a slight genetic, change. Like, we all have slightly different DNA anyway. But some people can have, like, genetically they can have maybe some, like, weaker muscles or more longer, like, muscles that are not as stable, or so, it can be sort of like and you can have a slight imbalance in the soft tissue after like a birth trauma or a process, but it doesn't show on a scan. So it's like the scanning is not good enough in the West. It's not sensitive enough to show like really, these really subtle like soft tissue imbalances. And sometimes these imbalances can be in the nerves, in the neurological system, like if you have like a whiplash and a nerve can get stuck. But because when you're young, and if these things happen, these traumas happen when you're young, they don't really show up on scans, because like young people heal from them quite easily, but the imbalance will still stay in the body, because people who have trauma and injury at any point in their body, this basically, like, they have like a soft tissue system that protects itself when you have that injury and damage. So, and it like grips on and it pulls the body out of balance. So this is like for anyone who has any infection or injury, or we're all going to get pulled out of balance a bit when we have that damage. But then, you know, that's supposed to then like sort of free up when it you know, depending on how much the tissue heals, and depending on whether the body can clear out all the disease and toxin that's in there. Because if it can't, then it can still grip and hold on to some of this like bacteria or toxin, if it's, you know, unable to get the strength to clear it out again. So yeah, like this is really common, and this tiny bit of soft tissue like hold, and it doesn't show on any scans, but we are developing in the West more sensitive ultrasounds and scans that can show they like minor adhesions, like you know, like the white gristly bit on me. It's like basically in the human body we have this, like it's like the ancient Chinese meridian lines that connects everything together. And when we get damaged and injured, this can become like, first it becomes swollen and sticky, like, and it protects the area that's injured. But then this bit like can become quite like a bit stiffer and more dehydrated and thicker after the injury, if the tissue is unable to fully regenerate and heal itself. So this is like the minor sort of injuries where the body can regenerate to a certain degree, but then part of it stays slightly scarred, adheres. And the problem with this scarring and this stickiness when it's damaged is the stickiness can stick to other organs and parts of the body where it shouldn't be. So basically, after you have any injury or any damage in any part of the body, it's important that you rehab it after. So this is well known in ancient Chinese medicine, because they know that the meridian lines, this is the meridian lines, the soft tissue, the gristly bit on meat that connects everything together. It like connects all of, you know, the muscles, it has patterns around, it connects into all the organs. You know, they know that if this isn't dealt with at the time of injury, the body's going to get more and more out of balance the more injuries you have that accumulate. So in scoliosis, because like I believe I had a birth trauma and it caused like a whiplash on my nerves because of the way I was born, like folded over, like breech, and with my legs up, and they had to push my legs down after I was born for ages. So I believe this caused like some damage, like the part where my curve starts. I believe that this caused like a overstretched ligaments, like a laxity, overstretched, and also like and because that got overstretched too far, it got damaged, and then like everything else sort of went and it crushed up here. So I can feel this pattern in my soft tissue, in my meridians, but it's not. The thing about these soft tissue meridian lines is they're not under our conscious control like muscles. So scoliosis, so this is probably one of the first things I should have said. Scoliosis, although it's like a postural misalignment, it's not something that someone can just correct, you know, with their muscles. Like they can't just go, oh, like I'm standing like this and like I'm like slumping into that hip and they can't just go, oh, I'm going to go to like a dance class and I'm going to like work on my posture and correct it, like that's kind of that is laughable to someone with scoliosis. And I did professional dance training, and I had just one like ballet teacher just say to me, like, why have you got such bad posture? Like, by this point, in your second year, like, why are you still standing like that? And I was like, I've got scoliosis. What are you going on about? Like, it wasn't because I wasn't training hard enough or pulling my tummy in enough or, trying to pull my pelvis in the right position, trying to stand up totally straight. Like, it was literally because I have unconscious damage and bits stuck, in my soft tissue, like, and you can't correct that with just exercise alone, like and also you can correct some parts of this tense stuckness in the soft tissue with exercises, but they have to be reflex unconscious exercises that are done in the correct position. So basically, like, we have reflexes to gravity that hold our bones up, and we have reflexes to pain where we pull away and recoil and grip on, and reflexes when we're scared and we raise our shoulders. The body is full of loads of reflexes. We have reflexes to vibration, to being overstretched, to being like over crushed, like, and this causes tension, like unconscious tension in the body. So this is the point. So a lot of people think scoliosis surgeons, they, like doctors in the West, they will jump to saying, mostly in the system, they say you just need to have bracing. And if it gets over a certain angle, then you have to have surgery. And they believe, like, for understandable reasons, that you can't really correct it with physical exercise. And because you can't really scan and detect where is damaged or what's going on, we can't really give it an internal medicine either. So they sort of believe that there's no real cure for this condition. But there is a whole new body of research coming out that I'm a member of, in the Myofascial Research Society and the Fascia Hub. So I'm a member of all this, and it studies the ancient Chinese meridian lines, and it studies all the neurological reflexes in the body, and it studies how holistic they are. So when I say that exercises, alone can't help correct an imbalance in the body and a scoliosis, what I mean is some exercises can help. So this is why in China they do Tai Chi, and in India they do yoga, because they already are intuitively aware that the whole body is connected together. So actually, there are research studies that show that you can have a problem with like an injury of your, like a spine, like pain and tension pulling from your spine, and it can cause a deformity in your toe. Like you can have like a bunion, like a twisted toe, and the actual like root cause of that is coming from the spine. So in a scoliosis, if I'm but sometimes the area is actually damaged, that is then out of balance, but sometimes an area is being pulled by damage somewhere else. So there are lots of different ways that imbalance can happen, and because we know that everything's connected together now, and this whole new body of research is coming out in the West, we also know that so you can do like positional releases and massage and things. So we know like these like stuck bits of tissue can be freed up with a lot of soft tissue massage work. So we know that like relaxation and heat and certain like putting certain ways of touching can activate certain neurological sensors in the body. So some parts of the body respond to deep touch and they like deep tissue massage. Some like the most sensitive, you know, soft touch. And like, especially if you had like a cut, you know, in a surgery through the skin, you know, you have to be very gentle, like, because there's lots of sensory receptors on the outside that respond to this soft touch. So basically studying every single nerve receptor in the body and what that responds to. So in the spine, we actually have lots of vibrational nerve receptors. And interestingly, there is a postural reflex that comes from the birth process that actually is linked with feeling physical vibration, and it comes from the pelvis up through the spine, because it's supposed to help us feel how to get out of the womb, how to be born. So we're like being born and we're like feeling vibration, you know, through the body and that vibration directs us how to come out. Because when we're a baby in the womb, we have like no muscle tension. We're like born floppy. So if you're born floppy, you've got no muscle tone, you have to respond to reflexes only, you know. And babies are born stuck in all these postural reflexes. So they're like just trying to not fall to gravity, and they're feeling vibration through the earth, you know, and they're feeling, you know, and it's even proved that our soft tissue meridian lines are responsive to electromagnetic energy coming from the universe, so from the sunlight. So you know, and they respond to heat, they relax to heat, but they tense to cold. So this is a really complex system that is responding to unconscious things happening all the time. They also respond to biochemical changes, so what we eat, and they respond to how we're feeling emotionally in our environment. If we're feeling anxious or scared or uptight, you know, stressed, or, you know, whatever we're feeling. So this, you know, you can see that this is not like, oh, this person's got an imbalance in the body, they've got like a misalignment of the spine. Like, you can't just go, oh, just do exercises, just that muscle's short, so let's just lengthen that. That's long, let's just shorten that. Like, it's not straightforward at all, because that's like trying to take conscious control of an area that's quite complicatedly damaged. It's been like shoved over and stuck, and everything's stuck together, and it's connected to your liver, so it's quite sensitive. So, you know, and there's like emotions associated, you know, with each organ. Like if an organ is restricted or damaged, you know, you're more likely to feel that emotion as well. So, you know, having scoliosis can have emotional implications. It can affect your personality. It can affect the way you're feeling, you know, because obviously no one likes to feel in pain all the time and restricted, you know, and you know, sort of squashed and scrunched in the body. But if it's like affecting the organ, you know, like the liver, which in my case it is, it's going to make you maybe come across like a little bit like you're angry, like at times, or you're pissed off, or you're, I don't know, like it's, you know, and there's different, you know, like the lungs can be affected in scoliosis. People can have like sort of restricted air, and that can cause like, a bit more of a sadness and a grief in someone's personality. So basically, this is a complex system. And even like talking, because it responds to physical vibration and energy, like spirit, electromagnetic energy, even like having counseling and talking through can help your body. You can feel the vibration through the meridian lines of what you're talking about. You can feel where this stuck energy and stuck soft tissue is, and trauma. And you can, sometimes people can actually get like you've got something off your chest just from having counseling. So this is a system, you know, I know people with small scoliosis that have actually felt their tension relax, and things like help and improve, and their pain just from having counseling, or just from learning to meditate and you know, have maybe a spiritual practice or whatever it is. So yeah, so this, like, basically this is Scoliosis Awareness Month, and I feel like I've waffled a bit, like, too long. I've kind of taken a bit of a while to get to the main point, but what we need is more awareness that things can be done to help scoliosis. So what we don't want with scoliosis and with any health condition really is that one problem happens, things get out of balance, and then we just do nothing, and then you get injured again because you're already out of balance, and then we still do nothing, and then this gets more and more to the point where we get really sick. Like someone with a scoliosis can be perfectly healthy. They don't have to be sick. Like there maybe is a conception in some like collective in the conscious mind that a lot of people get scoliosis after, like it was very common back in when people got polio. So this spinal surgery of correcting a scoliosis was actually invented for people who'd had polio and had a scoliosis after polio. So, I mean, this scoliosis surgical approach for correcting the spine, you know, in my view, is not suited to every person. Even if they have a curve that is deemed large enough for the surgery, I don't think that's necessarily the right treatment for that person, because first of all, you don't know. Some people have a curve big enough, but it's not necessarily going to get a lot bigger. That's it. Like you don't know how big that curve, that imbalance is going to get for a start. And also people get corrections. So, you know, by doing all these therapeutic things that we've studied now and we know about, by having, you know, having the right biochemical diet, like if you have more alkaline in your diet, your body's going to relax more, you know, and acid is causing more tension, and heat is causing more relaxation. But it's about a balance of relaxation and tension in the body that we want to achieve. So and you can like take lots of, you know, you can take lots of herbal things and tree resins and supplements and things you can bathe in and rub through oil on the skin, and these things can like help regenerate tissues that are damaged. So it is thought in the medical community that once there is like a certain amount of damage, like I've read a study where it says if healing takes longer then I think it was like 2 weeks. So if you have an injury that's serious enough, or a disease like where it's damaged for long enough and it doesn't get better, you know, sort of around 2 to 3, I don't know, I think it was 2 weeks, but I might be getting it wrong, it could have been 4 weeks. They're saying if it's not getting better that quick, then you're like doomed, you're like screwed, like that is like scarred forever, it's never going to regenerate, and we need to like, you know, study stem cells, and we need to do genetic engineering to get the body to regenerate again. But I mean, this is not true in my experience. Like there are other things that you can take, like I'm taking propolis at the moment because I've got severe scars in my back because they did the spinal surgery on me because my curve got, you know, big enough, and I don't think that spinal surgery was the right treatment for me, and I feel like it's caused a whole lot of other damage in my body, and it's made me sicker, you know, it's made me stiffer, more stagnated, more, you know. And actually I was not sick before I had the surgery, I was not in any pain, I just had a wonky spine, like it felt weird, I didn't like it, I didn't like the way I looked and felt in myself emotionally. But like, you know, I feel like having then this rods in, 2 solid rods, has caused like much more disability, much more pain, stiffness, stuckness. I just don't really think it was the right solution for me, and I feel like my spine needed to move, it needed mobility, like and if it got stagnated and stuck, it makes me unwell, it makes me more tired. We have lots of lymphatic drainage points all the way up the spine. So the spine, you know, it has natural curves forwards and backwards in the lumbar and thoracic. It's meant to be fluid, like when you look at a dolphin swimming in the ocean, you know, and this fluid flow through the spine, you know, is what keeps us healthy, because everything grows from the spine. So I mean, there is like a spinal surgeon who actually quit doing spinal surgery because he thought it was done like too often and too much on people, because he knew about this new research. he decided to quit being a spinal surgeon because he thought, well, there are other options, there are other approaches, you know, that can realign the body. And he knew about embryological development and how important the spine was to the whole, and he coined the term biotensegrity. So he's part of the Myofascial Research Society, and you know, he likens the spine to like a sail on a ship, and every other bit of the body, every other joint and tendon and muscle is like a tension strut holding it up, and everything, but it has like you know, these muscles, they fan out in all different geometrical angles, like a whole geometrical structure holding the sail of the ship up. And you know, if one thing, like one hip is down, one shoulder is forward, one anything is slightly out of balance, the whole structure, like the Leaning Tower of Pisa, can collapse. So you know, and he thought that, you know, why would you like necessarily assume that you have to correct it from the central structure? You know, like what if this is being pulled out from the shoulder and that's why this curve is forming? You know, what if we need to work here? You know, and in some cases the problem is at the spine. You know, I'm not saying that it doesn't help some people. Like some people who have this spinal surgery do feel better after. They're very grateful they had it and they feel like it's helped them, but most people who've had it, like some people have lots of pain before they have the surgery and they feel like their pain's improved, but they're still in pain. You know, anyone who's got rods in their back will be in pain for the rest of their life. It's just the level of pain that you're in, and if that pain is better than the scoliosis that you had before. So some people get really good corrections with this scoliosis surgery, but like, and some people feel that it was the right choice for them. You know, their pain is improved, their posture's improved, they feel better about themselves psychologically, they feel like they look better, you know, and that's great. But for me, I mean, yeah, as I said, I was in no pain before, and I'm quite like a bendy, like hypermobile person, and like, you know, a lot of studies show that people who have like more hypermobility, like, and are not, you know, they're a bit more sensitive and fragile, you know, because the muscles are like over lengthened, and then you go and shove like a solid structure in, like that just didn't work for me. Like I was just like, my body rejected these rods 20 years down the line from chronic infection, and they've now been taken out. But like, you know, because I've had so much damage done to my tissues now I really have had disease ravage my tissues, like infection, you know, I'm aware that can cause a scoliosis and make it worse. So, and you can have even like toxins in the body that can cause a scoliosis, like radiation, nuclear radiation, mercury, like heavy metal poisoning. Like there's lots of different causes. As I said, this whole meridian system is totally holistic. So this is a big challenge for science, big challenge. But this is Scoliosis Awareness Month, you know, because most of scientific studies are done like studying just one treatment. And does it work? Is it like getting results that can be like proper scanned and studied, like proper evidenced? And there is proper studies with like holistic with massage, you know, where they put a camera, you know, they've scanned it, ultrasound it, even put cameras in bodies and shown that a whole organ that's stuck and adhesed is actually now freed up and mobile again, you know? So like there is like lots of new research and proof that like alternative and holistic treatments help. You know, you just have to like shop around and make sure you get the right treatments for your condition, because every scoliosis is caused differently. So and here's to hoping that the medical system in the West and the doctors will finally, this will go in the mainstream totally, and we'll finally catch on to this. Because as I said, you know, even if you don't get a scoliosis in your life, where the chances are over the age of 60 you're more likely to get it than not, you are going to have joint pain at some point in your life. You're going to have some sort of injury or back pain or something where you need a treatment that works for you. Like you might not want to have a joint replacement, you might not want to have a surgery, but you know, for some people, like the joint is damaged enough in the spine, like it's crushed enough, you know, in the knee or whatever, like, you know, that they actually want the surgery, and it can help them. So, you know, these treatments really need to work together. and more awareness needs to get out there. And yeah, so this is, and I think also psychologically, people's perception of people with scoliosis, especially who develop it at a young age. So it seems like, you know, psychologically and emotionally, getting this as a teenager is really upsetting. You know, as a female, like, I'm like, oh my God, like my whole figure looks off. Like, am I going to be attractive, you know? And then also there's a feeling like you don't really fit in, you know, as well as you used to, because you have this weird, funny, wonky posture. You know, your like brain is not aligned over your body like the same as everyone else. And so, like, actually, emotionally, psychologically, you know, you almost neurodivergent in a way, because I mean, I don't really like that terminology. It's sort of like given more for autistic and ADHD and dyslexia, dyspraxia, but these conditions are super common as well nowadays. And, you know, people have found with some people with scoliosis, there's some studies like this sort of neurodivergent thing, like there is stuff in common with that. So I mean, and when you think about it logically, if the brain is not fully balanced and aligned over the body, and the body is wonky, you know, like that emotionally is going to have, and socially is going to have an impact on someone. And especially if people are looking at them thinking they look like a freak, you know, because they've got a wonky spine, or they're like not really fitting in, like as a woman, you know, like I was quite, this curve in my spine made me quite skinny, you know, and my hips looked smaller and things like this. So, you know, it made me like a bit more like airy fairy, like my personality. Like your physical posture is linked with your personality and your emotions. There's no getting away from it. Like, you know, society judges people on how they look, and then their energy and how they feel and come across to people, like emotionally. So yeah, so I think awareness that, first of all, that it's a really common condition and it has loads of different causes. So just because someone has a scoliosis, it doesn't mean that they've got a disease, you know? It could have been caused from a birth trauma or an injury. And secondly, you know, and even if someone did have a disease that caused the scoliosis, you know, that disease isn't necessarily there anymore, or, you know, that was in the past and it's just done damage and now they're disabled. Like, you know, it is kind of a disability, really. But yeah, even with scoliosis, it can become more disabling for some than others. Like some people live without pain their whole life, and they don't have any surgery, and they don't even really do any treatments, and they just get on with it, and they don't have much pain really. But some other people are totally crippled and disabled by their scoliosis. They can't work. They have constant, like, back pain can be really debilitating. They have to constantly lie down and stretch and release their spine all the time. So, you know, like this, yeah, it is a multifactorial health condition, and it can affect people psychologically and emotionally as well. And so, yeah, this is just my really long video for Scoliosis Awareness Month, and just to give hope, like, you know, because I've done my physio degree and I'm a member of the Research Society, I just want people to know that in the West, research is developing. There's a whole body being built up. I mean, these things take a long time. These dissections where they've like discovered these Chinese meridian lines exist, and everything connects together and actually follows the meridian lines. They've actually proved this in dissections in the West. And they call them anatomy trains. If you want to look them up, myofascial meridian lines, anatomy trains. Like, if you look these things up, there's like just so much research now out there. And I think it has been going on for like since the 60s. So this is like nearly, we're getting close to 100 years of research. And just to think that this is stuff that has been around since ancient times in China and India. So, I mean, let's hope that prejudice from the West on like religious prejudice or things like that don't get in the way of real scientific research. Let's hope, yeah, like, I mean, it can take a long time to change a way a nation thinks as a whole. It can usually take, I think it takes over 100 years. It can take century, at least, you know, over 100 years, 150 years. Like, so, you know, we could be another like 40, 50 years down the line before this gets into the mainstream. And it has to get into the mainstream with an approach, because a lot of people are taking more spiritual, religious approaches to meditation and to doing these alternative therapies. So it has to be a way that's like purely scientific as well, I think. Although I'm all for, you know, if you have a spirituality and belief system that you want to follow, I'm all for that. But yeah, like for me, if I'm doing things that are really helping my spine, I know there's science behind it. I know there's a cause and a reason. Like, I know that if I use this herb, or I've like inhaled this incense, or I've eaten this food, or I've done this specific reflex, you know, exercise, I know there's a cause for that and a science behind it. So yeah, I think it has to be scientific. But yeah, I think that people need to open their mind up, and also like scientific scanning and research and testing. I mean, I think that has just a little way to go still for doctors to fully embrace this. And it is a new way of thinking because it's holistic. So a lot of research is done like just doing one thing and studying that. And of course, that's not going to correct a scoliosis, it's just doing one thing. You have to do the whole package. But there is lots of research now of whole package, like, you know, courses that include a bit of everything, but even they don't necessarily include everything. They don't do counselling, they don't do nutrition or herbal stuff. Like, so it can be quite restrictive research that's out there. So that, in my opinion, that needs to change. But then the more you add into a research program, the more expensive it's going to cost. So remember, research is expensive, it's funded. So like drug trials, you know, they're going to be cheaper and simpler to do, you know. And even surgery, like it's just one procedure, you're doing the same thing on everyone. Like, these are easy studies to do. Studies, you know, with holistic programs of therapy are usually unique to the individual as well. So there can be universal. Of course, we all have the same anatomy. If two people have the same cause of their scoliosis, yeah, the same treatments, you know, will most likely work and improve things. But because you don't know the exact cause of it, it can be complicated. It can happen before someone remembers, you know, in their childhood, in their birth, like, and you don't know the exact mechanism of how that birth caused it. It can take years to uncoil and discover this pattern of causation. So yeah, it's quite a complex thing, but for sure, you know, people need to be aware that things can be done to help their health, even if they think it's out of their conscious control. Yeah, because it's not within our conscious control, is it? Like what food we're eating, our digestion, our breathing, our heartbeat, like all these things happen unconsciously. So, and every activity we do, we're having unconscious reflexes, you know, affecting our whole body and posture. So, I mean, I think going on a program and doing treatments like that are going to alter your reflexes in your body and help regenerate damaged tissue with herbal supplements that you use, and yeah, doing the right, like anything, even like singing and sound vibration and drumming, like there's lots of things you can do that are going to affect your unconscious body and realign these things and re-strengthen, get back the fluidity, you know, and the slide and glide from being stuck and stiff and sticky and like when it's damaged, and loads you can do. So yeah, I think this is my scoliosis awareness video done for today, and also to take into account that these, when you do get changes in the unconscious sort of meridian system, these can be slower. Like these, it can take quite a while for, sometimes like it can be instantaneous relief and release. A lot of the time you notice it's doing something for sure. Like if you don't feel that this is doing anything, then don't continue. You're wasting your money and time. You know that it's doing something, but it can take a while for the whole structure to adjust and you to eat the right foods to get the full strength back again. So yeah, these people who get corrections in their scoliosis, you know, they can take it can be like a year, 6 months to a year before they're getting corrections at all. And there's lots of people getting them out there. There's people like avoiding surgery, like, you know, reducing their curve 5-10 degrees, and like 50 degrees is like the limit for surgery. So they're like getting them smaller, and there's even people with really small curves that are like I've seen ones fully corrected. So I think there's a lot of hope out there for people with scoliosis, and people with any chronic health condition. Like there's loads of holistic and alternative treatments that you can try and do. You've just got to find the right ones for you. So yeah, that's my scoliosis awareness video complete. Over and out. I hope this wasn't like really boring and long video. All right, thanks. Bye.